This is JNN's Pagin Doc, and I'm your host, Dr. Cardell Espinosa. It was Stu Geiger who said, "Let your heart guide you. It whispers, so listen to it carefully." The heart is one of the most important organs in the human body. It is crucial for delivering nutrients and vital oxygen that every single cell needs for survival. According to the World Health Organization statistics for 2012, 17.5 million individuals worldwide are affected by cardiovascular diseases.
Cardiovascular disease is a general term used to describe diseases of the heart or blood vessels. It includes peripheral vascular disease, coronary artery disease, cerebrovascular diseases primarily, but includes other less common entities such as congenital heart disease, rheumatic heart disease, and deep vein thrombosis and pulmonary embolism. Blood flow to the heart, brain, and periphery can be reduced as a result of plaque buildup or a clot building up within the walls of the blood vessels. Additionally, a clot can travel from one part of the body and travel to another area. For instance, a deep vein thrombosis or a DVT can cause a pulmonary embolism. But how does it all start in the first place? Atherosclerosis, sometimes called hardening of the arteries, occurs when fat such as cholesterol and calcium is built up inside the lining of the arteries, forming a substance called plaque. Over time, this buildup narrows the artery and blocks blood flow.
Is important. Careful what you eat, like certain season. MSG, one of the wickedest poison to the heart, and black pepper.
You have to have a good diet. You have to eat the right food, a lot of vegetables, fruits, stuff like that. A lot of water. I know water is good for the heart, especially coconut water, because they say coconut water washes the heart.
You have to exercise properly, you have to eat right, and you have to know what the food do to your body.
And one of my favorite meat, a pork, which is the egg. You don't even stay away from that.
And you have to do research and even food and even the internet and certain stuff like that. And visit your doctor regularly, often, to know what's operating in your body and the right way.
I believe that proper dieting, proper regularly exercise is good for your heart.
You have to eat like a lot of omega-3 food stuff that do healthy work to the heart.
Welcome, Dr. Christian, to JNN's Pagin Doc. Today I want to speak with you about cardiovascular disease in Jamaica. What are we seeing here in Jamaica?
Well, cardiovascular disease is really comprises of diseases that affect the heart and the major blood vessels. So we see things like heart attacks, so coronary artery disease, stroke, diseases affecting the peripheral artery, so we call that peripheral arterial disease, and things like heart failure. So the common ones would probably be the coronary artery disease and heart failure.
So why are we seeing more of that in our population?
A number of different reasons, and it all boils down to the risk factors, which mainly are like your hypertension, your diabetes, smoking, cholesterol, family history, because genetics also plays a part in it as well. And the prevalence of these diseases are increasing because diet has changed. Many people don't have the time anymore to cook their nice Sunday dinner.
Yeah, they're eating out of
a box. and they have to eat more fast food, you know, work. Sometimes they don't get time and they just have to grab a quick bite. So your diet has changed, and it unfortunately tends to be the unhealthy foods that people are consuming. And then there's exercise. People are not exercising as much. People are glued behind their computer screen, the iPads, the phones. Yes. So they're not out there, you know, doing a lot of activity. And all of these things are going to contribute to higher levels of getting hypertension, diabetes, and then it causes now cardiovascular problems.
I mean, I remember when we were training some years ago, maybe 10 years ago, we probably saw a heart attack once a month or twice a month, and now it seems to be the order of the day.
Right,
I mean, it really is remarkable how the demographics have changed. So are we seeing it more in women or men or both? Younger, older?
It depends on the age group. So, I mean, we know that cardiovascular disease is now the #1 cause of death. But the demographics sort of change. Now, age is not a factor in this because it can affect from age 20 right up to, you know, over 100. So don't think that because, you know, you're 30, you can't get a heart attack. So in younger people, we do see probably more men, but then as women, because hormones tend to give a little bit of protection to the women
before the
menopausal period. But as they pass the menopausal period, the women catch up to the men and sometimes even passes the men. So, you know, but again, having the risk factors puts you at an increased risk of these conditions. So even as a woman, even if you're still in your premenopausal age group and you have symptoms, that's definitely something that you need to consider.
We have different roles: emergency, cardiology. I tend to see these patients as they come into the hospital. So for you, just tell us quickly, what are some of the signs and symptoms that we look out for with a heart attack, for instance, or heart failure?
All right, so for the heart attack, the #1 symptom is chest pain. And the chest pain typically is in the center of the chest. It tends to be described as a pressing, like an elephant sitting down on your chest. Now, it's important to say that not everybody has those symptoms.
Especially diabetics.
Especially in diabetics who may not have no pain at all. So you do have some what we call atypical symptoms. So they may have it more on the left side. They may feel it in their jaw. They may feel it in their shoulder, their left shoulder, their arm. So it's important to also understand that these other areas can also mean that it's a heart attack as well. Sometimes they may get associated symptoms. So they may get the sweating or short of breath. They may get racing of the heart. You know, these things can go along with the chest pain. But it's usually described as the most severe pain that, you know, you've ever experienced. So if you're having a pain that you think is really bad gas,
and it's not the usual type of pain that you've experienced before,
they definitely need to go and check it out.
In terms of the heart failure now, because we tend to see more of that.
We see a lot of heart failure, and mainly because, and I guess when we get to treatment, because many of our conditions are really not properly treated, and so it ends up leading to heart failure.
And how does that present?
The #1 symptom is shortness of breath.
Especially worsening shortness of breath.
Right.
What should alert a diabetic that they're having something related to the heart?
Well, in the case of no symptoms, there's really nothing that you can do per se, other than making sure that you screen yourself on a yearly basis. That's the only way you're really going to pick up any signs of any serious thing happening.
So it's very important that if you're older and you're wheezing, that must be checked out.
That definitely should be. It could be the heart. It could be the heart.
That's very important. So in terms of the investigations that we do, I know from my standpoint, if you come in with a heart attack, for instance, there are tests that we do, ECG, the troponin. For you as a cardiologist, what are some of the tests that you do too?
Well, some of those we do as well. So basic blood investigations is definitely a part of it, looking mainly for the risk factors, so the cholesterol. We may need to look at kidney function, you know, that sort of thing. But ECG is probably one of our, you know, the baseline, main screening tool that we use. You know, it's relatively affordable for everybody to get an ECG. But then there are other tests that are very important to us. The echocardiogram, which gives us a lot of crucial in giving us the details. That's what's going to diagnose your heart failure. That's what's going to diagnose whether you've had any damage to your heart after a heart attack. But there are other more sophisticated investigations that we do, such as in people who have like racing of the heart, palpitations, we may do something called a Holter. Right? Similar to the ECG, but you put it on and you go home with it for 24 hours. There's also what we call an angiogram.
Right.
An angiogram is used for people who have
That's
chest pains.
Right.
And that's what we do to look at the blood vessels to see, one, confirm that there are blockages, and then we see how badly blocked the blood vessels are.
Thank you so much for joining us today on JNN's Pagin Doc. That was really very instructive and useful for us. So thanks again.
Thank you for having me.